I'm a family physician and a health services researcher in the Department of Family Medicine. I see mostly adolescent patients at the Ypsilanti Community Middle School, and that's through the Regional Alliance for Healthy Schools program. I also take care of a lot of adolescent pregnant women at the Corner Health Center. And I also see patients at the Ypsilanti Family Medicine Clinic. Growing up in Flint, it was apparent to me that a lot of the challenges that people in our community were facing were systems level problems, not necessarily individual level problems. So the potential to help people and improve the lives of people through fixing system levels problems is really exciting to me. The Robert Wood Johnson Foundation Clinical Scholars Program is where I developed a lot of this passion for working with underserved communities. I love being in communities where I get to see firsthand some of the challenges people are faced with, and it drives me, it gives me energy to do the kind of work that I do in the office. My work is focused on tailoring interventions for adolescent pregnant women. Something really exciting that I'm working on now is looking at how social media and text messaging can be used to understand teens. It's an honor really to work with these adolescents to really understand the problems as they're experiencing them. And there's nothing more powerful than understanding it in their shoes, through their eyes. And that's one of the things that really informs the kind of questions that we ask here, and to make sure that we're on task with the things that are happening to the people that need help the most. If I had to choose one issue that was facing a challenge facing healthcare now, I would say it's our messaging. Right now, we're allowing other people to dominate the conversation and lead the conversation. And one of the things that I love about IHPI is that they provide the resources and training for researchers like me to tailor our messages and hone our messages so that everyday people can understand them. The University of Michigan doesn't just have one or two great divisions or departments or centers. Almost all of our centers here are outstanding, which makes it easy to find experts in a lot of fields. So I consider the University of Michigan inherently an interdisciplinary place, but the fact that there's a physical location that people come to makes it easy for people to collaborate, for these synergistic collaborations to occur. And that's one of the biggest strengths of IHPI. There's so many things that I do here that I think couldn't be done in any other place because of the support and resources here, because of the diverse collaborations that occur. We're able to not only do really groundbreaking research, really interesting and important policy analyses, we're able to disseminate them in a way that makes a really big difference. A lot of people who do research understand how hard it is to even get something that's important published and read, maybe published in the right places. But in my eyes, the next step is disseminating it to lay audiences, to make sure that policymakers understand, to make sure that everyday people understand. And so that's something that IHPI does a wonderful job of supporting people in reaching that goal.